All right, thank you to everyone who's joined. This is Anthony Alaka with Torrey Hills Capital, and I want to welcome you to the Ventripoint Diagnostics webcast for June 22nd, 2021. I hope all of you are doing well, and I want to thank you for attending today's virtual presentation. All of you are familiar with Ventripoint Diagnostics. You've all been on these webcasts before. Many of you own the stock. We started working with Ventripoint back in September of 2020. And since then, George Adams and his team have done an amazing job of delivering on milestones and other positive developments. And we feel that even though the stock has performed well, we're just really getting started in terms of the upside potential in the stock. And I wanted to take this opportunity to reconnect everyone with Ventripoint Diagnostics and really highlight the company's recent progress and key announcements that have set the company up for long-term success. As you know, Ventripoint Diagnostics trades on the OTC market under the tickers VPTDF and on the TSX Venture Exchange under the ticker symbol VPT. Shares are trading with a market cap of roughly $40 million US. The stock has pulled back about 50% from its high, and we feel that it really represents a great opportunity for investors looking for a long-term growth investment, especially with everything that's happened here in the last 6 to 8 months. With us today, as always, to discuss Ventripoint Diagnostics and the company's recent highlights are Dr. George Adams, the company's Executive Chairman and CEO. We also have Alvira Macanovic. So sorry, Alvira, if I did that. The company's VP of Operations, Regulatory Affairs, Quality Assurance, really George's right-hand person. George speaks very highly of Alvira and the job she does at Ventripoint. So I want to welcome you both today.
Glad to be here.
Yeah. Well,
likewise.
Yeah, George, our viewers are very familiar with Ventripoint. So if you could just give a brief overview of the company, and then we can really focus on the 6 or 7 specific key developments that have happened with the company, and then have you talk about them in more detail, and then we'll open it up to Q&A. I know we do have a few questions in queue, and I'll try to add those or ask those as we move along. And the other thing is, before we get started, if our viewers have any questions during the presentation, just type your question into the chat box or the Q&A box, and we'll make sure it gets answered. And with that said, I'm now going to turn it over to George Adams. George, the floor is yours.
Thank you, and a good afternoon to everybody who's tuned in. So I'll go quickly through what when we started back in, came back onto the market in September last year. We've traded over 700 million shares since September. And while that's a wonderful accomplishment in itself, that's all the work done by the investors who are out there trading away the stock. The company's been focused on just trying to execute on its business plan. And that really was a case of coming back onto the market, begin trading, put some devices out, sell some devices, get them installed in key centers with top cardiologists who will use the device and talk to their friends about it, and really begin a viral marketing campaign. The second thing that we were working on at that time was a major collaboration with one of the top 3 ultrasound companies in the world. And since then, of course, we've announced that we have a collaboration agreement with GE Healthcare, which is the #1 imaging company worldwide, #1 cardiac ultrasound company worldwide. So that being said, they only have 42% of the market share. So there's still 60% out there that belong to other people, some regional players, and then Philips and Siemens are the other 2 out of the big 3. But we were very happy to work with GE over the last year and a half almost to put our solution on their platform and gear up to provide that complete package, the hybrid, their system and our system married together, to all their existing customer base. And so we can talk a bit more about what that customer base looks like and what GE agreement looks like. We've also had, along the way, we had all our convertible debt converted into shares. We had all the warrants associated with that convertible debt exercise. And we've all now had some additional warrants that were issued actually 4 years ago and never repriced at 50 cents, finally expired at the end of May. And so we're now third week in June. So we're 4 weeks past that event. So we really have virtually no warrants still outstanding in the company. So there's no headwinds, there's no cap on the stock now. It can go anywhere it wants to go. There's no need to worry about people selling stock, exercising warrants and selling stock into the market. But I also added a bit more to the treasury. So at the end of the warrants being exercised that were associated with convertible debt, we had about 2 years worth of cash in the bank. And then with this last, about 33% of the 50-cent warrants were exercised. We ended up with another year's worth. So we now have 3 years of cash in the bank, which is a huge ability for us then to think about longer term, think about what we want to do on a number of pathways. We also were awarded a Canadian government grant to work on our 4D system. And Alvira's here and she can explain to you what 4D is all about. But basically it's next generation, it's motion analysis of the heart. So in 2D, you measure areas and line, segment width, height, length. With our KBR tool, we were able to turn that into volumes. So now you can measure, the volume, regional volumes, ejection fractions, those kind of volumetric measurements very accurately and very reproducibly. And with 4D, we were now setting the system up to be able to motion, like twist, strain, maximum, rate of change of the volume, if you will. So that's another whole dimension of how a heart works. And I mentioned this a couple of weeks ago, there's just been a paper come out showing that the twist of the heart is an independent predictor of death within COVID-19 patients. So if your right heart is enlarged or your left heart is inflamed, and now if the twist of your heart is altered in COVID, all three of those are indicators that you are not going to make it out the other side of a COVID infection event. So, and it's time to start doing, and obviously therapies, the whole world's trying to work on therapies for COVID. And so the more we can characterize what goes on with the heart, the more we can characterize when therapies work. So it's an important piece of work to really try. What we need is not vaccines for COVID, but we need therapies, effective therapies that help the heart when it's under this huge stress of COVID infection. Alvira's been working very diligently with some of our longtime users, top cardiologists worldwide, and getting white papers written. A white paper is an in-depth analysis of what our machine does in a particular case or types of patients. And they've been published now on the website. I think there's 2 of them up there. Is that right, Almir?
Correct.
Yeah, 2. So I encourage you, if you want to hear from the experts exactly why our machine makes a difference in their patient population, I recommend you read them. They're not written in deep medical ease or anything, so they're totally accessible to people with not that much medical background. Just have to know that you have a heart and how it has a left and a right side and it pumps, and that's what you really need to know. And we've continued our marketing activities, by attending and actually sponsoring 2 major conferences. They've been virtual conferences, the Canadian Society for Echocardiography and the European meeting just recently. So in there, we've had virtual exhibit booths. We've been able to demo the product to people who come through the booth virtually. They were both quite well attended, and we had some good engagement. We've identified a number of other groups who want to have follow-on in-depth demos and talk about other patient populations that they want to study and look at with the system. And that's all part of the process of getting a new medical device into routine use, is that the really innovators, the key people, the people who have time to study and research heart disease, get a new tool like ours, and they can then study a bunch of cases, publish it, and everybody starts realizing that there are better ways to treat these particular patients. And also, I've been working in the background trying to identify, and a lot of our focus has been on right side of the heart, the right ventricle, and also primarily on pediatric cases, but also on COVID and pulmonary hypertension and those kind of things where you get lung congestion. And there are another whole range of heart problems on the left side of the heart, where the left atrium and the left ventricle, the characterization of the volume and ejection fraction of the left atrium and the left ventricle are critical to understanding those indications. So if we have time today, we can talk about them. Otherwise, we'll just answer questions. So a little bit more on GE. GE has markets into 160 countries. It has 4 million imaging devices out there. About 500,000 of those are all ultrasound devices. They are obviously the gorilla in the space, and so we're overjoyed to have them as our partner. The agreement calls for exclusive agreement of our equipment on the GE device for GE customers. It's not exclusive. It's not exclusive for other ultrasound equipments or other ultrasound analytics packages. So we can access the other 60% of the market, and we are currently interviewing distributors in Europe and North America to address the other 60% of the market. As we are also trying, we will also go forward and engage with Siemens and Philips, who own another probably 45% of the market, to see if we can do the same kind of a deal with them as we did with GE. But GE came to us a year and a half ago and basically said, we can't do what you guys do. We want to offer that to our customers are asking for it. So can we work together to try and get your system working in our platform? And that was not a trivial exercise, but we did accomplish it. And now, so we're moving forward. So we have a collaborative agreement with them now to develop that further. And also we would like to show them the 4D stuff, the newer stuff. They have no right to, they have no right to it, but it would make sense to include the 4D analytics, these new analytics in the total package. So we have defined terms for rev share. We've agreed to that, and we have regular technical meetings. In fact, one of them is going to go on this week. Is that right, Alvira?
Yes, Friday.
Friday. Okay. So, the challenge here is to integrate the Ventripoint machine into the GE EchoPack platform. We've done that. We've shown functionality. We've improved the interface, and we've got it all seamlessly put together now. And Alvira, why don't we give people an idea where we're at with that? How are we doing with the internal testing?
So we've made our way through testing all of the existing features. They've all been tested, and I believe code review is now complete as well. We have recently added one extra little feature, so the guys are implementing that right now. And then that will be also tested, and then we will move into validation. We've also made the software have a look and feel to the GE branding guidelines as well, because they wanted it to be seamless, so that it looked like it was part of their system and not an external piece of software. So we've done all of that at this point.
So the plan is to hand that over, do the final validation testing, hand it over to GE. They're going to also test it to make sure we haven't messed up any of their functionality on their platform. And then we can get into training the GE sales staff and the support staff, the application specialists, and then GE can launch a marketing and sales effort initially in the United States, but the agreement anticipates a global partnership, and where GE will be the prime contact with the customer for sales, marketing, installation, training, support, and collection. So it's a very comprehensive role that GE will have going forward. This is the 4D. Why don't you go ahead and discuss this, Alvira? This is your baby. Yeah.
So this is lovingly known as the pumping heart. Right now, the way that it exists is nobody really has so the right ventricle is segmented into these different regions, and it allows the user actually to be able to focus in and take a look at, as George mentioned, motion of that particular chamber. So these things that we call these little tensors, these purple arrows that you see, there's approximately more than 400 of them, and they show how each part of the chamber moves from end diastole to end systole. What's important to note about this particular piece of technology is right now there's really nothing out there that exists for the right ventricle. that allows a clinician to be able to see this motion, but it's not even just a qualitative, it's also quantitative. So they're able to get measurements from these tensors. These tensors represent magnitude and direction, which, as George was mentioning, for example, when it comes to the twist and being able to visualize that, but also being able to get measurements around that will be important, specifically around COVID as an example. And there's a number of different diseases and disorders that our clinicians have started to identify, our KOLs that we've been working with, where they can see the applicability of this technology. It is created from 2D echo images. It can be created from 3D as well. We're compatible with both. And obviously the pumping pieces, you can see the change of the chamber from EDDES and back to ED right now.
Yeah. Okay, I think the rest of this is pretty much state of the, I stated many times before. So Anthony, why don't we just get into the questions here? Get on with it.
Sure. So we have a couple questions just at the beginning. Someone mentioned that the things they would like to listen for, and they're familiar with the story, is when you can expect, or when you think you could see cash flow positive. Do you think that's something that can happen next year?
Absolutely. Yes. I mean, our burn rate is only $80,000 Canadian a month. That's 60,000 US. We sell these machines for $50,000 each. So, 1.5 machines a month will get us cash flow positive. So
Yeah.
It's not a big, I mean, the huge margins on these things, it only costs us $5,000 to make them. We sell them for 50. We have a leasing program where we would get anywhere from $50,000 to $60,000 a year, every year, on a recurring revenue basis out of the machines. So, I mean, at this point, it's just a case of getting the machines out there. Once we get an installed base of 20 machines, we'll have a recurring revenue that will cover our cash burn. So I think and that's, with GE kicking in here, that's more than achievable by middle of next year. I mean, we've always had a target of 80 to 100 installations by middle of next year. Obviously, COVID is still slowing us down. I mean, it's just, it sounds like the world's starting to reopen, but we're Canadians, and most of the people on this call are Americans, and we both had the border continue to be shut down for another month between Canada and the United States, even though we're 75% of Canadians and had one shot of vaccine, and 20% have had 2 shots, and in the United States, like 40% or 50% of people are already double vaccinated. So yet we're still got the borders closed. So, and that's just an indicator of the same thing's happening in hospitals. They're just not opening the doors, getting back to normal business. They've got huge backlogs they've got to deal with. So it continues to be a battle to just get things done inside of a hospital. Alvira, have you heard anything more from the UK guys? Because I mean, they seem to be ahead of the pack a little bit. Are they still kind of shut down?
They still are. I was speaking to actually one of our folks for distribution, and he was saying, although things have started to open up, the hospitals still do have some lockdown measures where they're not allowing for outside personnel in still, and they don't see that will let up, at least for another few months.
Yeah, so I mean, they're ahead of everybody on the vaccination, even ahead of Israel now, and yet they're still basically shut down. I still think we can hit the 80 to 100 target next year. I think this thing's going to open up in the next few months, and there'll be such an understanding and such an ability to get things done. And I think we still have a shot at hitting the 80 to 100 next year. As I said, we only need to get to 20 to be cash flow positive. So I don't think there's any doubt we'll hit cash flow positive next year.
Yeah, and with the cash runway that you have, there's no need to really worry about raising capital.
No, before, now that we've got the GE deal done, and they're going to essentially be our frontline marketing group and building awareness about the application and the use of it and all that stuff. I mean, that takes a lot of burn out of what we had anticipated burning in the next 12 months.
Yeah.
So that $3 million really, we'll scale up a bit. We want to finish 4D. We want to do automated point selection, and we also want to look at another technique to look at maybe analyzing archival 2D ultrasound exams. So we got 3 high core development projects. We have a grant from the Canadian government for 4D. We've put in grants for the other 2 projects. So we may get some additional non-dilutive financing and grants in the next 12 months. But right now, we have all the money we need to finish those developments and be an effective partner to GE.
Yeah, definitely. So I've had 2 questions come in that are asking, are you making any sales projections, or is it just too early to talk sales projections?
Well, I just made one. I said we're going to get to 80 to 100 by the middle of next year. So am I making them? I just did. And I'm not the same sales target I've had for the last, since we came out 9 months ago. That's been our target, to get to 80 to 100 machines middle of next year. And I still think it's achievable, with the caveat that COVID has got to go away and the hospitals have to reopen. I think GE is going to add a lot of potential to getting there, which is why I'm not willing to bail on that target yet. And again, that's cash flow positive. That's everything, and that's the early adopter population, if you will, within this thing. And when you try to commercialize a medical device, you have the early adopters. You break, and if they get excited and turn on the rest of the masses, then you have a huge success story. The early adopters, don't get on with using it and publish papers and talk about it and get excited, then it really goes nowhere. And I've been involved with Pfizer and DuPont and Ciba Geigy and all sorts of large companies where we've done focus study after focus study, talked to regular doctors, early adopter doctors, curmudgeon doctors who wouldn't use a new piece of technology if you hit them over the head with it. And there's just no way to predict what's going to happen except get out there and do it. So, rather than spend hundreds of thousands of dollars on focus studies, we are just going to get out there and do it. Obviously, GE believes in it and is allocating significant resources to launch the product. I think that's probably the best focus study you could ever have.
Yeah, for sure. And do you think, what is a more profitable model for you? Is it the lease? Is it they buy the machine? And is it very different in terms of the bottom line for Ventripoint?
Well, yes. Yes, right now, the lease model is more profitable to us if they use it as often as we think they should, right? So, in any of the medical device with a consumable, which is basically the same, if you merge together the capital purchase model of $50,000 with the leasing model of a recurring revenue on a per case basis, you end up with essentially selling something with a consumable type market. So the more you sell on the capital market, the more money you make up front, and the more you get into the lease model, the more continuing revenue you have. So, the capital model says we would get $50,000 up front and $5,000 a year on support fees and $5,000 a year on consumables. So we make $50,000 up front and then $10,000 a year for 5 years, and then the machine would be obsoleted and we get to sell them a new model. In those 5 years, we would obviously go back and upgrade, sell them upgrades to the software. This is a tried and true model that GE and Siemens and Philips have been doing for 30 years. You come out every 18 months, you come up with a software upgrade and you charge the customer another $10,000. Actually, in GE's case, it's usually about $25,000 to $35,000 for an upgrade to the software. So to the hardware equipment you already own. So again, there's an opportunity there to come out and sell an upgrade to the software with the 4D package or, whatever, and some of these other automated packages and archival samples. So we have 3 development programs. We could, theoretically sell these devices for $50,000, collect $10,000 a year, and then every 18 months sell the customer another $20,000 worth of upgraded software. So over a period of 5 years, you would generate in the order of $300,000 per customer. And so if you look at the leasing model, obviously the software upgrades would be part of the deal. They would just get them automatically. So you're looking at $60,000 a year recurring revenue. So you're looking at the same $300,000 over a 5-year period. So it's a bit of a wash in terms of how much you make over a 5-year period, assuming, but actually I think the capital model is a bit more, I would say, because you get your money up front.
Yeah.
The leasing model, you have to depend on the people, on the technology maintaining its relevancy and continuing to use it on a continuous basis, on a good basis. As you know, we also have a plan to go in and get our own CPT code in the United States and upgrade the reimbursement for this procedure that we do, building a 3D model, or now I guess a 4D model, from a 2D sample set. Image set is right now has a reimbursement rate anywhere from 100 to, actually I looked it up the other day, 100 to $330 dollars, and we're going to charge $50 per case for our use of our software to do that procedure. So it only takes 5 minutes, 10 minutes to do it, as opposed to the old-fashioned way. It would take you well over an hour to do it which is why nobody does it now. So if we can get that rate up more in the $500 range, then we would up the per use fee to $150 to $200, which means we would, instead of making $60,000 a year on the lease model, we would be making $150,000 to $200,000 a year. So that, so the lease model has the added flexibility of being able to increase our revenue significantly year over year as we increase the value of the procedure and therefore increase the reimbursement rate.
Great. Yep. I want to get to all these questions because they're rolling in here. So this might be for Alvira. I think a lot of people are wondering when the GE validation testing will end, what the timing is for that. I know it's getting started here. So can you give us a time frame on that?
It's hard to give you a time frame on that because we don't know what we don't know until we get into the validation. So what's important to note is that we have done the verification and the code reviews, which are a significant piece of that. We have found some bugs that obviously we need to fix. And as we go through that process, by the time we hit validation, the devices, or rather the software, is almost should be where it needs to be. So the validation can go relatively quickly, or if we haven't identified an issue and it's identified during the validation, some tests need to be repeated. Sometimes the validation has to go through a second round. That being said, we're looking on the order of several weeks rather than days, just to put that into perspective.
Okay.
This is an extensive set of testing. It's more than 100 tests that are run on a simple piece of software. Simple meaning it's not, it doesn't have all these other, extensive features, but it's still a lot of work.
Yeah. Yeah, that makes sense. And obviously they want to make sure everything is working properly before they put boots on the ground and they start going to the hospital. So I completely understand that. A question.
Well, also have to realize, I hope people realize, is that, there are no sales, as Vera just said, that you as a GE salesman cannot go to a hospital right now and demo the product. You can do it over the web, and we all know that's relatively ineffective. And so, even if we were ready to push the go button today, GE would say, wait until our salespeople can actually go and engage the customer. So, it all comes back to COVID, not the rate at which we're traveling or the rate at which GE is traveling. It comes back to the environment that we're in.
Yeah, I agree. I mean, I think we are slowly coming out of the woods, on COVID, but it's just going to really be a matter. It's kind of up to these hospitals on when they're actually going to be ready to start sitting down with salespeople and things like that. George, with the GE collaboration, is it for new units only, or can you retrofit into old GE units?
Oh no, this is an upgrade to the software. So we're not.
Okay.
Yeah, no. I mean, it's there's no need for us to. Yeah, I mean, we can hook up our machine to anybody's machine, GE included. The trick here is that our software is going to be sitting inside the GE platform, so it's seamless. It's ready to go to they can make it. They're used to the platform. They know how to get in and out of it. They know how to access different modules in the platform. I mean, that's the whole point, is that there's virtually zero training beyond showing them how to put the points on. There's really no training required for them to learn how to start using the software. Yeah.
Most people within like 10 to 15 minutes understand how to drop the points and generate the calculations. It's actually really user friendly in that regard.
Yeah, I mean, you're talking about people who do this, 10, 20 times, 30 times a day for the last 10 years. I mean, you don't get to be a read echoes on your first day at med school, so or in cardiology residency. So, these are people who have been 4 years in a residency. They know what they're looking at. It's not a hard thing, and that's one of the advantages of the Ventripoint system. I mean, if you look at somebody like a Philips or a GE or a Siemens, 3D software package to analyze right ventricle. I mean, it's published data. It takes you 120 cases. It takes 45 minutes a case to do the analysis, and it takes you 120 cases to get any good at it, or you get a reproducible answer. That's 6 months of somebody's time. Nobody's got a senior cardiologist does not have 6 months of his life to spend learning a new technique. So it's, the fact that they can learn it in 15 minutes is a huge benefit.
Absolutely. And that was in fact too, that, there's remote setup available, and, it makes it pretty easy to get these things up and running. This is a question that you probably can't answer, but I'm going to ask, and maybe, you can tiptoe around it, but give us a little insight. Are you talking with Siemens and or Philips right now?
We talk to them all the time, and that's not a big secret. Everybody talks to everybody. That's part of the game. And, the big three, I think I've said this before, there's no secret here. I mean, Philips is next on the list. They've got somewhere around 30 to 35% market share. And, but they bought TomTec 4 years ago. TomTec was an analytics company just like us. They were state of the art at the time, and they've been working diligently to try and improve their software package to do right ventricle analysis and get a better, more accurate, more reliable answer, I guess. Sometimes it's somewhat accurate, but it's not reliable answer to even left ventricular function. And they've been struggling with it. That's the bottom line. But I do not see Philips coming and saying we're going to abandon this approach that we spent hundreds of millions of dollars on 4 years ago and take on your solution. I think once GE is out there and the GE people are using it, and again, there's very few shops out there in the world that are pure GE. I mean, any major echo lab has got GE, a Philips, and a Siemens machine. Got all three of them, because they all do some things a little bit differently than the others. And there's Toshiba and Panasonic and Samsung and Mindray and Fuji, and there's all sorts of different ones out there. So everybody mixes and matches. It's I've used the analogy before. Some people like Ford, some people like Chrysler, some people like Chevs, some people like Toyotas. I mean, it's just the way it is, right? If everybody believed that a Ford 150 truck was the only vehicle worth driving, and then we'd all be driving a Ford 150. So, it's the same thing. I mean, everybody has a slightly warms to a different machine or whatever. And so as we bring the technology into the GE machines and all these major shops, they'll other people are going to say, hey, I want to be able to do that too, but so get it on the Siemens or get it on the Philips machine. So I anticipate that those guys will be asking us in the not too distant future to look at what it's going to take to put it up on their machine too. But
Yeah.
in the meantime, we talk to them, but they're not interested right now, to be honest. I mean,
Normally,
Siemens would like to put it up on their platform, and that's a relatively easy thing to do. There's a whole bunch of different applications up on Siemens, but it's more like an app store, the Siemens program. They throw it up there, but they don't market it. They don't sell it. They don't, it's up to you. You sure it's on the platform, so everybody who's got a Siemens machine can access it, but you're the one who has to go out there and sell it, not, so it's a different model from the GE collaboration. But yeah, it's probably worth doing just to say we have it up on Siemens. But I think we made the strategic decision. It was more effective to go out and get real distributors who are talking to real customers and who will actually market and push and demo the product for us, because we would have to do that anyway. Even if we put it up on the Siemens platform, we'd still have to have a distributor go out there and actually introduce a customer to the idea, a Siemens customer to the idea that they could actually use this on their machine. So we have to do that anyway. So we're going to do that. We're doing that first. And so our focus right now is signing up distributors. And we got lots. How many we got? 8 in the UK or something that want to do it. We've got Germany. We've got lots of people wanting to be our distributors.
So even for Germany, it looks like we may be extending to all of Europe as well. They're quite excited.
Yeah, so we have
they get it.
Major distributors are excited about being part of our universe. So, and the GE, let's face it, the GE deal obviously helps that too, because if they know if GE's out there selling it, then I know I've talked to lots of distributors. They're a pretty cocky bunch. Like a lot of them say, hell, if the GE salesman can sell one, I can sell 10. That's just my attitude. I don't care who else is selling it. I can sell more than him. So that's just, if you've ever met hardcore distributor salespeople, that's just that's who they are.
Yep.
It's great. It's great. Yeah.
Well, that kind of leads into the next question. So obviously, if things start to really, expand, which I'm sure they're going to here in the next, 6 to 12 months, how many units can you build per month without increasing your monthly burn of 80K Canadian?
Oh, that's an Alvira question for sure. Yeah.
Even if we were to just build 2 per day, 5 days a week, we're looking at 10 per week, 40 a month. And one of the things that I need to stress is it's really not that difficult to build. We've actually really streamlined everything within the manufacturing process, even with our proprietary sensor technology. That's the most, I guess, trickiest to build, but we've got processes in place that allow us to, I don't know if I want to use the word mass produce, but definitely produce at a faster rate. So that's not even an issue. Even if somebody came to me with an order of 80, we could do that relatively quickly.
Yeah,
great. With the existing resources.
With the existing, yeah.
That's a thing you wouldn't have to really ramp anything up in a major way.
No.
In order to meet the increased demand.
No, I mean, when you start ordering, 40 or 50 or 60 of some of the components, you might get into some supply chain lags or something like that. Right, Alvira, I would think. You think? I mean,
no, actually, you know what? Yes and no. Most of our component parts, we haven't had that issue to date, and even with COVID, we've managed to get those parts in relatively quickly. And the parts where the lag may be, which we've planned for, is where there are parts that more in the electronics piece that are becoming difficult to source. But we've circumvented that by piling what we need in-house.
Yeah. So I mean, we're aware. They're not. The only real single source component, if you will, is the one we build ourselves. So we're in charge of that. Everything else is off the shelf, and I think if you start ordering 1,000 of them, you might at a time, but that would be that would be a great problem to have.
Yeah.
Yeah, exactly.
Yep.
I would welcome that problem, Anthony.
I know, right? Some problems are great to have. So
The car guys are having trouble getting chips, so
I know.
they're ordering them at a million at a time. So we're not in that ballpark.
Yeah. This might be a question for George. What keeps resistant cardiologists from wanting this equipment? I mean, it seems to me that every cardiologist you show this to, they want it. Is it just a matter of the hospital not buying it? I mean, how does it?
Well, right now it's bureaucracy. There's no doubt about it. It's a hospital bureaucracy. The hospitals are totally constipated. They can't get anything in and out of the purchasing department. We have cardiologists, key cardiologists who've been trying to get the purchase order out of their purchasing department for 6 months. So it's just bureaucracy, plain and simple. And so, it used to be that the machine was difficult to use. I mean, version 2 was difficult to use. So people who bought it weren't prepared to recommend it to their colleagues because it was difficult to use and it was difficult for the sonographer to do it. Now that we have version 3, the sonographers all love it. There's no problem using it. Everybody who's got one is happy to take a phone call and recommend it to anybody else who wants to call up. So that's gotten over that hurdle. And now we're smack in the middle of this bureaucracy, which is totally screwed up by COVID. I mean, if the first word on the purchase order doesn't say COVID personal protection equipment needed immediately, then it gets stuck on a pile and it's been sitting there for months, and there's just it's hard to imagine, but that's exactly how these hospitals are functioning right now. It's all about COVID.
Yeah, we've heard that from some folks like everywhere, Europe, United States, where they said that basically purchasing isn't even accounting is not even, administration is not even looking. They don't even want to hear about a device that doesn't say COVID at the beginning. They're not even considering it. Even like in terms of clinical trials and REB sitting, they'll sit for COVID related. They won't necessarily sit for anything outside of that. Really, the healthcare system's been overwhelmed and their focus is on COVID, as it should be.
And you can see it in the clinical trials. I mean, every clinical trial I know anything about is just dead stalled. They're not going anywhere, right? I mean, if it's a clinical trial on a therapy for COVID or a vaccine, sure, that's passing ahead full speed. But regular old drug type clinical trial is, the recruitment is slower than slow. I mean, it's just the whole hospital is totally focused on keeping its staff straight. And in the United States, I don't know, I read all the hospital daily hospital updates and things like that. And, you got hospitals that have no staff. They're shutting whole wards down because they can't get the staff to even open them up. Never mind the COVID wards, any ward in the hospital. So hospitals under a lot of stress right now, just trying to maintain any kind of a semblance of regular order. The echocardiography services are down to under 20% normal workflow. And even, so it's going to take a while for them to come back, but that's okay. I mean, we are pushing ahead, doing what we need to do, which is getting the key hospitals to adopt the technology and talk about it, and getting GE up and running. We want them to hit the ground running and with the best demo you could imagine, and just blow everybody away with the functionality that we bring. And part of our problem, frankly, is that there's so many benefits to the VMS system, it's hard to get it all in one sales call. So as you hear, every time I get on these things, I tell you one more benefit of the company. I'm sure the people on there are saying, not another one, but yeah, that's the way it is.
Yeah, well, that is another good problem to have.
It's a good problem to have, but you can't do it in a 30-second elevator pitch to a doctor. I mean, you've got to go in there and do the 10-minute, 15-minute demo and go through all the, fast learning curve, accurate results, reproducible results, ease of learning, all the benefits that the system provides on top of, ease, readily attainable, accurate information so you can treat your patient appropriately. Yeah.
Right. So this is another question, and we have time for a few more. Any terms or understandings with GE that would impede realizing full market value of the company in the case of a sale of the company? I know you've talked about kind of the magic numbers for, potentially, some sort of an acquisition.
Well, I'm focused on this word impede. So like, I'm not sure I'm not sure what the question is, impede. Do I see any reason why? No, I mean, the GE deal is a best efforts deal. There are ways for us, mutually we can walk away from the deal from each other. It's not indentured servitude. We're not, we can always go back to having it as an independent standalone system, being a hookup to a GE machine. That's not, customer would not like that. They want them integrated. Well, I guess let's go back to the GE Philips. No, sorry, the Philips Tomtech example. Okay, I sometimes talk about this one. So, I mean, Tomtech licenses technology to everybody. GE, Siemens, Philips, Toshiba, Panasonic, everybody in the world was using the Tomtech basic 2D analytics package. And they were getting geared up to use the 3D analytics package, except it didn't work very well. It still doesn't. And then along came Philips and bought Tomtech. And they actually put out a press release and said, don't worry, everybody don't worry, GE, Siemens, everybody else, don't worry, we'll continue to support the software you've all licensed, and we'll continue to provide you upgrades to the software as we develop them. So that wasn't, everybody sort of went, that's odd, Well, so then 6 months later, they went around privately at the American Society for Echocardiography and told everybody, you're never going to get another upgrade to this software.
Yeah.
All right. So GE, Siemens, all the other guys, Fuji, they learned their lesson. I mean, so I would say the more we engage with everybody else, the more GE is going to say, we can't wait for this thing to be gobbled up by Siemens or something. We better just take it ourselves, and then we own it. And then, so the more we show that, 3D analytics from 2D exams, 4D analytics is the next generation in understanding heart function. The more we show that these techniques are part of the future, the more GE is just going to say, well, we want to own the future, and that's the way it is. And I offered last time I was on the call, I'm not sure I followed through on this, but GE put out on their website, they have a roadmap of how, and they have a slide on there that shows 100 years of innovation in GE in imaging. And they show, all the way X-ray, first X-ray machine all the way up to, and you look at that and you see that, all the only innovations from coming out of GE in that imaging domain that they dominate in the last 10 years have been MRI and PET and nuclear medicine type innovations. There's been no innovation in ultrasound in 10 years out of GE. And, they pride themselves on being an innovation company. So, they are going to make a lot of hay out of this being the next generation, making 4D being the next generation of analytics. And they also want to make 3D echo real and work. I mean, they've got the best 3D probes, they get the best 3D images. They're still not good enough for clinical purposes routinely, but they're the leaders of the pack for sure. And, we can help them analyze those 3D images. And so that's an added value. And if we could get 3D, if they could be the very first company in the world to get 3D to be good enough, often enough to be used as a routine clinical tool, they would gobble up market share everywhere, because the huge advantage of 3D is instead of spending 20 minutes capturing 16 views in a 2D image, you spend 3 minutes capturing one holographic image, and then you can analyze it. Unfortunately, you can't analyze it often enough right now, but if we can fix that problem for them, then they would, taking a 20-minute procedure and reducing it to 5 minutes is almost a guaranteed way to become the dominant player in the field. So that's what they're hoping for, and we think we can help them do that.
Absolutely. There is one more question because we didn't get to touch on it, but I think it's very important. The joint venture in China with Yutian. Obviously, China is a humongous market with the, we've talked about it before. They're building 1,000 hospitals a year. They have a lot of cases of cardiovascular disease there. It's going to be a big market. Can you talk a little bit about your joint venture with Yutian and kind of where that stands?
Right. So Yutian was approved, the version 2 of the device for right ventricle only, which is manufactured by Yutian in Manshan in China. So they built a factory there. They got a whole bunch of government money, and they built a factory so they can produce these machines at hundreds a week if necessary. The huge 50,000 square foot factory they built, state of the art, really nice. So they're all ready to go. They've been building out their distribution network. They've had approval from the Chinese FDA since March 2019. So what's that, 2 years? It's been an approved medical device in China for 2 years. So that just tells you, even though China's got 34,000 hospitals, they've also got 35,000 bureaucracies. So it's not any different than here. Things take time. So they claim they're making great headway. They have devices in 8 of the top hospitals, in one in each province, one in each of the top 8 provinces. And that they're pushing forward with a large sort of government mandated purchase order for a number of machines at one crack. So they're going the political route of selling them in chunks of hundreds. And they tell me that takes a little more time, but when it finally hits, they'll be able to, it'll just start rolling off so that's their business plan. That's their go forward approach. We wish them the best of luck. We give them whatever support they need. On the technical level, we don't help them with, I have no idea how to market something in China. So we don't bother doing that. We have an agreement that we will do a share swap sometime in the future. So we'll both own equity position in each other's companies, and that's how we're going to get our major benefit from this relationship. We also have a management fee when they get up and running that we will get paid, which would essentially be a royalty on sales, on continuing sales. So we have 2 ways that we can benefit financially from the relationship. And sometimes people say, well, isn't that deal and that joint venture in China going to screw up if GE comes to buy you out, or Philips or Siemens? Isn't that going to screw up the deal? And my answer is always, GE's got more than enough capability to acquire that joint venture, anytime, and it's just not big enough to worry. It's just a fly on an elephant's head. So GE could easily go in there and just take over that business for a small piece of change. So it's not going to impede our ability. It's not going to slow them down. I mean, when Pfizer came to buy my Corvita company, we had a joint venture going in Japan with Sumitomo. Sumitomo is a pretty big company. Pfizer just said, here's a blank check, go buy them out. So we went over and negotiated the buyout. They were happy. They got paid a lot of money to walk away from the project. And that was just, that's the kind of thing you do when you're a big company. You just say, I either own it all or I don't own any of it. And here, what's it going to take for me to own it all? And we did the same thing for a company, a venture we had in Belgium. We went over there, wrote the guy a check, and he gave up all his rights to the product in Belgium. So that's the way it works. That's how acquisitions work. If you want it, you just add it on to the price. And if GE wants to pay, I figure, by the time we get 80 to 100 machines out there and the adoption curve is looking good, we'll be well into the $200-300+ million takeout price. Adding another 10, 20, 30 million bucks to get China is not going to be will be a 10-second decision in that negotiation.
Yeah, for sure. I think we're going to leave it there. I want to thank George and Alvira for coming on today and giving us an update on all the milestones that are happening with the company. I just really wanted to summarize at this point some of the great things that have happened. First, the balance sheet and capitalization have improved tremendously. Company has no debt, cash runway of 3 years, no warrant overhang. Obviously, this GE collaboration we think is going to have a huge impact on the future of the company. GE Healthcare is the $18 billion healthcare business of GE. I think that's, once we can kind of get through the COVID fog, and it looks like Alvira is doing her job behind the scenes of getting everybody ready to go for that when it does happen, which is great. It looks like the China joint venture is progressing well. That's going to be a huge market for Ventripoint. The news of the new heart motion patent is also very positive, and I think there will be some new market opportunities with the COVID long haulers suffering from cardiovascular risk. There's going to be a need for being able to scan a lot of people quickly. We didn't touch base on the fact that there was some insider buying with George and other insider purchasing stock higher than the current levels. And I think we'll see some more distribution agreements on the way. So George and his team have done a fantastic job over the last 8 or 9 months, and it's been really great to work with them. So I want to thank George and Alvira for coming on. Just for everybody from the Torrey Hills group that's on, today's code word is Marlin, Marlin. In the meantime, you can get additional information on Ventripoint Diagnostics by visiting the company's comprehensive website at ventripoint.com, including details on the VMS 3.0 system, as well as additional information. There are those white papers. I think everybody should go check those out. Those are really interesting. And again, I want to thank our viewers for taking the time to get up to speed on Ventripoint Diagnostics. If anyone has any questions, feel free to reach out to me, Anthony Alak at Torrey Hills Capital. You all have my email address, and I'll be happy to answer any questions. Any questions I can't answer, I will forward to George or Alvira. Until then, everybody be safe, be well. Thanks, George. Thanks, Alvira, for your time today. Appreciate it.
Thank you.
Thank you. Okay, bye.